My next guest is Dr. Rachel Levine, Assistant Secretary for Health at the Department of Health and Human Services. She's previously served as Physician General and Secretary of Health for Pennsylvania. You know, she's a doctor. She's cool. We've had such great conversations in the past. Dr. Secretary, Assistant Secretary Levine, first of all, happy Pride. But second, I know this is a big issue. And I want to start out just at a human level. And as I've thought about the pandemic, and you think about the stress that has happened in so many communities in this country, which has exacerbated underlying conditions that maybe we weren't tending to well enough before. You know, I know it's an unfair question, but what are the things we can do to change the vector for the people in need?
Well, thank you very much for your introduction. I'm so pleased to be here. I think you're exactly right. I mean, the pandemic has certainly shown the level and depth of the health disparities that we see in our nation. And that includes physical health, but it also includes mental health and substance use disorders. And so we need to address this really at a department-wide level. And that's what we're doing under the leadership of Secretary Becerra.
You know, I early in the pandemic, I interviewed Francis Suarez. He's the mayor of Miami, and he shared with me, he said, Steve, people may be talking about working at home, but he said the family stress, the interpersonal stress, the stress of not with children and what's going on, then you may have people with underlying conditions. And we've kind of talking about workplace dimensions, and sometimes, workplaces can be stressful. Sometimes they can be a needed part of one's social functioning. And we've just seen the workplace move from buildings like I'm in now into, online. Are there any playbooks on how to sort that out? If you're an employer and you want to partner with those resources out there in this new environment that's gone, 99% digital, are there things that you see, either when you were in Pennsylvania or now when you have these federal national responsibilities that would help workers and help employers in some of the stresses they're experiencing?
Well, you're exactly right. There have been so many stressors during the pandemic, including illness, grief, job loss, changes in jobs, as you said, loss of routines, food instability. And it is an unprecedented situation. So, of course, with this novel pandemic and the greatest pandemic that we have seen, the largest pandemic that we have seen in 102 years, I'm afraid there is no playbook. But I think that there are some lessons learned from the pandemic. One is that we are all interconnected. And I think that's an important lesson. Second, of course, is the importance of public health. And the third, I think, is the importance of mental health. I think that what employers can do is, one, to talk to their workers, to talk to their employees, and to survey them and hear what they're saying on an individual basis and on a collective basis, and to go slow. I think that trying to make abrupt changes, for instance, everyone has to come to work in the next week or so, will increase the anxiety and the challenges that their employees are having. So I think communication is so important, and going in a slow and steady pace.
Rachel, let me ask you another question. I think sometimes we have a little bit of hypocrisy baked in to our institutions and our own lives. And what I mean by that, I've worked for places in the past that focused on mental health, raised the issues in an editorially important way, but not this place. We won't get into that. But when they encountered someone who attended an event or who they encountered who had mental health challenges, they behave like everyone, like many others do. They did very little help. They kind of did anything. That's why I become a fan of what's called mental health first aid, which the National Council on Behavioral Health has tried to spread around the country, just to try to create awareness on how to be helpful, how to have empathy, how to do it. But I think we all talk the talk of trying to be responsive and help, but I think many people don't know how to walk the walk. And again, with your experience in this, are there elements of empathy? Are there elements of understanding this that allows people to kind of walk in this person's shoes who's having these challenges and to be more support as to being part of the problem?
Well, I think you're entirely correct. I think that stigma, driven by stereotypes that people have about mental illness and about substance use disorders, both from thinking about groups of people, but also sometimes individual people, their individual employees, or even family members, is really challenging. I think it goes back sometimes to fears that people fear what they don't understand, what is beyond their experience, and I think that that type of fear can lead to these type of challenges that you're talking about. So I think the way we address that is through education, both just in terms of the facts about things, but also this empathic education that you're talking about. I think that we can do that from a public health perspective, and that's what we're going to try to do at HHS.
Another thing, Congressman John Katko just shared an alarming statistic that I didn't realize. He said for every suicide, every person who commits suicide, there are 29 attempts at that. We have data that show that 1 in 4 young adults has contemplated suicide. We have the Trevor Project. You just tweeted this out in your Twitter feed. You said, where the Trevor Project said that 42% of LGBTQ youth seriously considered attempting suicide, and more than half of trans or non-binary youth, and you were alarmed by this. I mean, I think all of it's alarming. I did not realize that this challenge was as high as it was during this past year. I knew it was bad. I mean, honestly, I just want to throw my hands up. What can we do?
Well, we're going to need to address this in a systemic way across the administration and across Health and Human Services. So, first, the American Rescue Plan included $4 billion to expand access to mental health service treatment and substance use treatment. The Rescue Plan Act also included $30 million for harm reduction services. That's like syringe service programs. In addition, Secretary Becerra and Acting Secretary Tom Coderre of SAMHSA announced community mental health service block grant of $1.5 billion and another substance use prevention and treatment block grant of $1.5 billion, not million dollars, billion dollars with a B. At HHS, the Secretary has revitalized the Behavioral Health Coordinating Council. And so we're going to be looking across the department, all of the different divisions at this issue, including a specific subcommittee on suicide. You're right. There are a number of different aspects of this. There's suicidal thought or ideation. There's suicide attempts and then tragically completed suicides. We need to look at all aspects of prevention, primary prevention in terms of suicidal ideation in the first place, and then secondary and then tertiary prevention dealing with people who've attempted suicide but not completed it, and then work to treat them as well.
Right. Rachel, let me just ask you finally, I've got Congressman Dave Joyce coming on shortly. I've interviewed Rob Portman, Senator Portman, Senator Whitehouse, others on this kind of broad issue of both mental health and opioids and how do we do it. And one of the things that comes up every once in a while is a sense that the administration, whether it's the last administration or, the Biden administration, is uncoordinated when it comes to things like, large scale waivers to help, create kind of a blanket use of opioid abuse or opioid addiction drugs and others. And I'm wondering, do you think you're in a place now, given your background, given where you are, to help coordinate this response inside the administration? And do you think we need something like a White House conference on mental health in the country to help draw in? Because I have to tell you, it's one of the few areas right now I sense a lot of bipartisan support. Maybe that would be good for the country. But just wondering if you're in the right place and the secretary is in the right place to help drive some of these coordination questions which constantly come up.
I think we're in a very good place in terms of coordination. These mental health and substance use disorder challenges are absolutely a priority for President Biden. They are a priority for Secretary Becerra. And I think that this revitalization of the Behavioral Health Coordinating Council will be very, very important. I've been working on these issues my entire career, both in academic medicine and then as the Physician General and Secretary of Health of Pennsylvania. And I really see that we have the team and we have the system in place at HHS and across the administration to deal with these issues.
Well, Dr. Rachel Levine, Assistant Secretary of Health in the Department of Health and Human Services, former Secretary of Health in the state of Pennsylvania. Great to see you again. I look forward to seeing you for real in town soon. So welcome to Washington, and thank you so much for joining us today.
Thank you very much. It was a pleasure to be here.